So shifting now to more of your academic pathway, before you became a researcher and did all of this research, you began your career getting a Bachelor's of Arts in integrative physiology at the University of Colorado at Boulder. What was your thought process choosing the field of study?
I was interested in science and math. I was interested in health. And in the university environment, that meant you had to be pre-med. So that long degree name means that I was pre-med.
Did you come in? So how do you land at integrative physiology as opposed to maybe like anatomy or biology or chemistry?
So the integrative University of Colorado at Boulder had 2 degrees that were in which you would get all the science and math that you would need to be qualified to apply to medical school.
Okay.
One was molecular and cellular biology. So if you really wanted to go into the details, benchtop science, cells, mitochondria, all that juicy stuff, you went that route. Because University of Colorado Boulder has a huge science program, so they had kind of 2 giant majors. I think they were the most popular majors in at the school. And so the second batch was integrative physiology, which was your anatomy, your epidemiology, your neuroscience. So thinking more about body systems and not at the cellular level.
Okay, makes sense. And while you were in undergrad, you participated in a social policy global leadership program for students at Charles University. Tell us about this experience.
Oh, that was cool. So that was a summer program through the Global Leadership Program, and it was students from all over the world. So students from, oh my goodness, Jamaica, Romania, Albania, Colombia, India, Pakistan. I know I'm forgetting. I mean, I'm going to forget some of the countries, and my friends will yell at me. But it was wonderfully and amazingly diverse. And we spent the summer in Prague. Again, lucky us, beautiful city. Talking about social policy and leadership. And that was fascinating. We're reading foundational texts in leadership like Machiavelli's work. And this young man, Bogdan from Kazakhstan, was like, yes, this is foundational leadership. This is what is right. And students from other countries, from democratic countries, Kazakhstan at the time was a monarchy, was like, oh, we have a really different understanding of how to structure public systems. And that was fabulous to be with students from all the world who had very different understandings of what public systems can and should be regarding social policy. That gets into a lot of, and public health can get in this too, of like who deserves public support. You know, at what point do we set qualifications for things like Medicaid or SNAP or WIC? And so talking about that at a global scale was really fascinating. Who gets support from public systems and who doesn't? And how do we decide? And who decides?
That does seem like a very great like thought experiment. And like one of my favorite classes during my master's program was a class where we did comparative health systems and just like looking at how different health systems are set up, because it's just crazy like to think like so many systems are set up so differently, and then to the point of like what are the social policies that are aligned with those systems.
Yep.
How is the eligibility, and I feel like that's something we don't talk about a lot. I feel like just how eligibility can really create shift in dynamics for socioeconomics for people, and just how important that is. So that's interesting.
Yeah. And what, benefits cliffs we create
Mm-hmm.
and how the different systems intersect. And I think that's where I swing back to maternal and child health. So many states now are creating like departments of early childhood or departments of children's health, which is so interesting to see it coming out of a Department of Education or a Department of Health. They're creating this new department. But I think it's really exciting. I've done some work with some of these states of how do we make our public systems cohesive so that if a family is accessing childcare subsidy, they also get connected to WIC and Medicaid and TANF and Section 8. Why do we make families who we know are navigating all sorts of structural and racist barriers knock on 10 doors and go through 10 different arduous processes to get support?
Yeah, it truly is. It boggles my mind that we have created a system where the people that need the most support have to go through the most barriers and hurdles, and yeah, to try to like prove themselves worthy of that support, which is, yeah. Were
Yeah.
there any key takeaways that you had from your undergrad experience?
Yeah, I would say the world of work and the career paths you can take from undergrad is so much broader than your degree options. So I mentioned, I was interested in science and math. I was very much, pre-med was the only path that I could take. And I had no interest in being a physician. I learned that by the time I finished undergrad, that I wanted to talk about systems and
Mhm.
policy and data. I didn't want to talk about, individual health outcomes. And I'm so grateful that I didn't think, okay, I'm pre-med. That means I have to go to medical school. That means I have to be a physician. It's like, okay, I have a science degree. I learned a lot about science and math. I'm going to work in a public health system just to try it out and see, and found my calling. So I'd say don't limit yourself based on your degree. Think about it as you're training your brain, you're getting a perspective, you're learning a lot of skills, and then it's just going to get broader and more complex when you graduate. So don't try to set your lane in undergrad. Is my big takeaway. I'm really glad I didn't become a doctor.
Likewise.
Was
So
that part of your path too?
yes, I was pre-med as well, and failed to get into like Masters of Medical Sciences program, and got like Google ads for Masters of Public Health program, and then yeah, everything changed when I entered into the program and just learned more about systems and health inequities, and yeah,
Yep.
things I just didn't learn about in my biology pre-med degree, which is interesting.
Yeah.
But hey, neither here nor there. You continued on to get your MSPH, a Masters of Science in Public Health in Maternal and Child Health at the University of North Carolina at Chapel Hill.
Mm-hmm.
What led you to pursue this? As well as you shared that you had that shift from pre-med to public health.
Mm-hmm.
When did you learn about like public health as a field that you could work in?
Yeah. So I graduated amid the recession, the
Mm,
2008, 2009 economic recession. So layoffs were rampant. We were in an economic downturn. Not a lot of folks were hiring. And so a lot of my peers from undergrad ran to medical school. Like, I'm just
mm,
going to stay in education to avoid this terrible, terrible job market. But I knew that didn't feel like the right path for me. So I graduated and did all sorts of random odd jobs before I found a full-time job. I had to be scrappy and nimble. And I think young people today may have to as well, as we see what's happening in our current system. So I did data entry for um, a maternal health researcher at the University of Colorado at Denver, and literally sitting on like an overturned bucket at a desk in their lab doing data entry. But I was like, I'm in a maternal health lab. All right, I've got a toe in the field. Um, I worked for um, a group trying to find community leaders and fund them to do work to support the community, which was really, really neat, rather than a funder saying, here are my ideas, implement my ideas. They were trying to find in communities facing, navigating all sorts of inequities, who are the leaders with bright ideas of what could help and lift up and support this community, and funding them directly. I worked with them. I did a million little odd jobs. I worked night shifts in an emergency room doing registration. I'd done that night shift through undergrad. So I did a million little things and did a ton of informational interviews. So I bought coffee for anyone who would meet with me. If I read about someone and their job sounded cool, I emailed them and then asked them, who else do you think I should talk to? And I learned about Kaiser Permanente and thought, ooh, this is a cool health system, and that it is integrated, right? That the health system cares about public health because they're footing all the bills. They're the insurer and the provider. So they really care about the public's well-being of everyone they're insuring. I thought, ooh, that's interesting. I'm not seeing that in other health systems. I've worked in ERs for 5 years. I'm not seeing that care for the public well-being. And so I met, no joke, probably 17 people at Kaiser. If they were doing an event, I went to it. I just talked to anyone and everyone that I'm curious about this system. I want to work for this system. And the 17th person I talked to was like, well, we have an opening coming up. I mean, it requires a master's degree. You don't have one. It was in knowledge management. I had to Google what that was. But I read a lot about knowledge management. I prepared for that interview, and I am so very grateful to this day. That boss who hired me at Kaiser is my mentor to this day. And I'm so grateful that she took a chance on me, and I loved that job. And so for nearly 3 years, I worked for essentially Kaiser's kind of public health department. They did all kind of public health messaging campaigns, care coordination, employee wellness programs were all housed in this unit. And that's where just my mind was blown. I graduated thinking I have to be a doctor if I want to do science and talk about health. And that's at Kaiser's where I learned, oh my goodness, public health is a whole new world. It's thrilling. How do I do this? And so pivoted to pursue public health.